Concerned by the surging cases we're seeing in some countries, particularly in Europe and the Americas. Health workers and health systems are being pushed to the breaking point.
Even with several vaccines hitting the market in coming months, with the world in the grip of the second COVID-19 wave, there's still a very long and difficult road ahead until we see a return to at least some semblance of normality.
Let's get a deeper insight into this story and go live to Rome and speak to Professor Emeritus of Epidemiology, Marcello Ferrada de Noli. Good to see you. Interim data, Marcello, suggests the Oxford AstraZeneca vaccine offers 70% protection in 2 doses, but up to 90% by tweaking somewhat the initial dose. Now, the markets seem to be disappointed by those numbers. How would you interpret them?
Well, I could start by quoting Anthony Fauci, which is the director of the National Institute of Allergy and Infectious Diseases of the US. He said, well, we have a dilemma here with this double standard of 70% and 95%, because what are you going to do with the 70% when you got 2 vaccines that are 95%? So who are you going to give a vaccine like that, which is less effective? So the second thing is that it's not clear the number of participants in the trial where the 95% effectiveness was obtained. So the thing is very confusing. They have to make up their minds how they're going to announce the thing now.
That's the point, isn't it? Because Pfizer initially said their drug was 90% effective. Moderna said theirs was 95%. Pfizer then corrected their figure to 95%. How literally should we take any of those numbers? Clearly, everyone has a big interest in winning the vaccine race.
Well, if you have other 2 vaccines in the market, as considered by the United States, they are talking about the AstraZeneca and the other one. And then we have the Russian vaccine, Sputnik V. So they are over 90% effectiveness. So why would the public, governments, etc., decide to buy a lower a vaccine which is less effective? I mean, that is a question that have to be answered by the people who announced those vaccines.
You mentioned Sputnik V. Russia recently asked the WHO to approve its vaccine. Several manufacturers have done the same. How crucial a step is that?
Well, the Russian vaccine here in Europe has already arrived for final testing in Hungary. Last Thursday, I think, it arrived here. Here in Italy, at least in one commune near Bergamo, we have asked for the possibility to acquire, to purchase a number of doses of the Sputnik V to cover the elderly population of this community, which are at the highest risk of infection, and so we are expecting with much interest to see the response for the Russian authorities on this request. It is local.
Yeah. Sputnik V, Marcello, much like Oxford AstraZeneca vaccine, they don't have to be stored at ultra cold temperatures, unlike the Pfizer BioNTech rivals. Could that give them, and in this case we're talking more about AstraZeneca, could that give it a major shot in the arm, as it were?
Well, you see, the market worldwide consider you have poorer countries and you have countries which have a better position, and those countries perhaps are not going to be so focused on the problematic issue of storing the doses in lower temperatures or etc. They would take the vaccine which is more effective than the other one. So you have poor countries, and if they have difficulties to afford, all those store places with lower temperatures, really low temperatures, perhaps they will decide to get the less effective, in my opinion, AstraZeneca vaccine. So this is this is a situation related to the economic possibilities of different countries.
Can we just touch upon the price as well? The AstraZeneca vaccine is expected to be much cheaper than the Pfizer and Moderna drugs, about 10 times less. That's according to the Financial Times. What do you think, Marcello, is the main reason for that?
Well, the main reason would be marketing, and in the marketing concept, they will have to compensate the problematic picture, the problematic legal picture that has been associated with the AstraZeneca vaccine. You have to remember that the first clinical trial they did not manage so good in order to prevent infections in the animals they were experimenting with. The contrary, but anyhow, they went to phase 2 and to phase 2/3 combined, and in that in that section of the experiment, they got patients with some severe problems like neutropenia, which is a decrease in white blood cells. In any case, they went in many cases over the phase 3, in which there were recorded at least 2 cases of transverse myelitis. So it is a very problematic clinical picture that it is emerging from the AstraZeneca vaccine. To compensate, I think, of course, they are going to promote or they're going to perhaps see that the price is going to be affordable by countries which they don't have any other possibility than to take it because of the price. But myself, I would not recommend that.
Always good to get your take live on the program. Professor Emeritus of Epidemiology, live from Rome today, Marcello Ferrada de Noli.
Thank you very much.
Well,